College, KM Hospital. This video is directed to friends and colleagues there. I've been posting a few videos which I think are relevant or which we think are relevant. Hopefully, we can get a few more people involved in the activity um, to make it a little bit more useful to students and interns and maybe residents if they are interested. Uh, Starting off with tools and instruments, um, theoretical instruments and tools that will make your life as students and as clinicians a little bit more interesting, uh, and maybe you will be able to navigate your clinical lives a little bit more comfortably than what we have done or what we did when we passed out of CGS. All other students, residents, interns, or anybody else is also welcome to watch these videos and comment on them. Um, these are going to be short presentations or short talks. We will try to make them interactive if possible. Um, the clinical question or case or history or problem that I'm touching on is patient comes in and he has headache and he has been told that he has high blood pressure. So that is a clinical case or presentation. That's all the data you got. If you want more data, I'll also put in that he has no other problems, medical problems. Um, and what do we do next? Um, if the clinical presentation is headache and he has been told that he has elevated blood pressure, you will ask him your clinical history, which is your tool or one of the tools. Your next tool is your clinical examination. So touching on the next tool, which is your clinical examination, you have taken his blood pressure and he has high systolic readings and high diastolic readings. And your question is, what do we do next? This is a question that comes frequently in our clinical lives. If somebody has elevated blood pressure readings, and what do we do next? Do we send him home and ask him to do yoga and relax? Uh, do we send him to the specialist? And the question then is, which specialist do we send him to? Should we send him to the neurologist so that they can opine as to whether there is something wrong inside his head that is causing him to have headache? Should we send him to the cardiologist because his blood pressure is elevated and he's at risk to have certain adverse clinical events? Should we try to treat something like this at our level, uh, or do nothing at all and basically kick him out of the office or clinic or wherever you are seeing the patient? The only result may be that he will never come back to you, or that's the best outcome, or at worst he might abuse you on social media. To prevent any or all of these outcomes, uh, maybe we should think a little bit more about what we can do since he has come to us with a problem, with a question. Your examination is essentially focused, as for the purposes of this particular chit chat. Your examination is essentially normal. However, there is one particular thing that can be done that will help you to get pointed in the right direction, um, and that is fundoscopy or ophthalmoscopy. Um, Now, I'm not going to describe or show you how to use ophthalmoscope, but there are many good videos on how to use a fundoscope or an ophthalmoscope and use it to look at the retina and at the fundus uh, and at the disc without dilation of the pupils or in an undilated eye. And I would strongly recommend you that you see these videos that have already been posted. And the one from University of Virginia, I believe it's on Mariel TV. That's the site, or you can look up on YouTube, ophthalmoscopy and University of Virginia as the search terms, and it has a fairly good two-part presentation on doing the fundoscopy and using the ophthalmoscope on an undilated eye. In brief, it's an instrument which you will find in your ophthalmology department, or if you carry it in your pocket, that's fine. You can use it. If you already know how to use it, that's great. Uh, but if you're a student or if you're an intern and you are not well versed with using the fundoscope or the ophthalmoscope, it's a useful tool to have in your tool set to gauge your next step, especially in the clinical situation that we just talked about. So you have your green lenses and you have the red lenses. The green lenses are for looking at the cornea, the iris, and the closer examination of the eye. And the red lenses are for they have long focal length or infinite focal length, so they you can use those to look at the fundus and at the disc. When you're looking at the disc in this particular patient, you are looking at the disc margins and at the uh, disc itself. You're looking at the retina and you're looking at the arteries and you're looking at the veins. You can look up pictures as to how to distinguish an artery from a vein in the retina. You can look up pictures also as to what a normal disc is supposed to look like and what is the disc to cup ratio supposed to look like. That takes a little practice, and you have to look at a few fundi, you have to look at a few retinae, and you have to look at a few discs to know that there is papilledema or there is no papilledema, there is AV nicking or there is no AV nicking. But the point of the conversation is that when you use the fundoscope, when you use your red lenses, when you use the appropriate amount of light, when you have the appropriate position, uh, you can peer into the undilated eye and come to a conclusion as to what should be the next step regarding the patient's presentation with hypertension. And this happens all the time in our clinical lives. It's not absolutely necessary to do a fundoscopy, but it is a useful tool to have which will guide your risk management strategy or patient management strategy as to what should be done next, because it helps you grade the intensity of the documented hypertension. Therefore, I will direct you in this particular conversation to understand the use of a fundoscope or an ophthalmoscope, um, and its importance in gauging the intensity of the hypertension. In one of the previous conversations, we've talked about what is blood pressure physically uh, defined as. So this particular conversation is related to uh, using the fundoscope to gauge and categorize and classify your question or your clinical question of blood pressure and what you need to do. If the eye exam is normal, then your next step would be, since you started with physical examination, excuse that, you started with the history, now you started with your clinical examination. Your last tool set would be investigation, and the next one would be treatment. So the question to ask is, what is the investigation for a patient who comes in with just blood pressure? Um, since you're dealing with volume and electrolytes and renal function, the basic investigations would be fairly straightforward. You get electrolytes, you'd get renal function, you'd get a urine analysis, you could get a blood count, and lastly would be treatment, which we'll talk in another another session. So, going once again from start to finish, every clinical problem will start with history, which is your tool, goes to the clinical examination, which is your second tool, investigations, which is your third tool, and lastly, you go to your therapeutics. So I will strongly recommend or suggest to you looking up one of the other videos for using ophthalmoscope and um, the use of the ophthalmoscope to gauge a clinical situation wherein patient has pure blood pressure with no other problems, and that will help you in coming up with a decision tree as to what we should do next. Thanks very much for listening.